Before sunrise, the battlefield is silent. But soon, this quiet field will become one of the most terrifying hospitals in American history. You're not holding a rifle. You are waiting behind the lines with a medical bag. And soon, every scream will be your responsibility. In the Civil War, surviving the bullet was only the first test. The second began when the wounded reached the surgeon's table. A field hospital was rarely a hospital at all. It could be a barn, a church, a farmhouse, or a tent turned into a place of impossible decisions. Inside, the surgeon did not face one patient at a time. He faced a line of men, each one running out of time in a different way. There were no antibiotics, no modern blood transfusions, no sterile operating rooms, and no time to wait for perfect conditions. But the old myth is not the full truth. Many Civil War surgeries used ether or chloroform. The nightmare was not the absence of medicine. It was its limits. Chloroform could dull the pain. It could not stop shock, infection, blood loss, or the pressure of hundreds waiting outside. The surgeon's world was wood, iron, candlelight, mud, and speed. If he hesitated, the wound could win. Every case began with one brutal question. Can this man be saved now, later, or not at all? This was medicine under fire, not calm, not clean, and never free from the sound of the battlefield. The mini ball changed everything. Soft lead, fired from rifled muskets, could shatter bone in ways surgeons could barely repair. To modernize, amputation looks like horror. To many Civil War surgeons, it was sometimes the only chance left. If shattered bone, torn vessels, an infection left no path forward, the surgeon had to act before the body collapsed. Speed mattered. A skilled surgeon could finish a major operation in minutes, but speed did not make the burden lighter. One wrong cut, one delayed choice, one unseen infection, and survival could disappear. Infection was the enemy no one could see clearly. Germ theory had not yet transformed battlefield medicine. A soldier might survive the bullet, the table, and the night, only to lose the fight days later in a crowded ward. Outside, more wagons arrived. The battlefield did not wait for the hospital to catch its breath. Rain turned roads into traps. Supplies arrived late. Patients arrived cold, soaked, and already fading. The surgeon needed instruments, clean water, bandages, light, assistance, and time. On campaign, every one of those could vanish. Even water became part of the battle. A single basin might serve too many patients in too little time. And still, order began to emerge. Ambulance corps evacuation routes and field hospitals became part of a growing system. The Civil War forced medicine to learn under fire. Every major battle became a terrible classroom. But progress did not feel like progress to the man on the table or to the surgeon standing above him. For them, history was not a map. It was breath, pulse, pressure, and a decision that could not be undone. Imagine hearing your name called from 3 directions at once, knowing only one patient can be reached first. That was the true nightmare. Not the tools, not the sound of battle, but the moral weight of choosing. Some patients could wait. Some could not. Some were given comfort because medicine had reached its edge. The hardest part of the job was not holding the instrument. It was carrying the memory after the tent went silent. Many surgeons worked for hours without rest, moving from one table to another until their hands barely obeyed them. By midnight, the hospital became a different world, half sanctuary, half machine, lit by fire and necessity. Outside, families might never know what happened in those final minutes behind the canvas walls. The Civil War was fought across fields and forests, but its medical struggle happened in rooms history rarely shows. Here, courage looked different. It was not a charge across a field. It was returning to the table again and again. The surgeon could not save everyone, but every life pulled back from the edge proved the work still mattered. Some men returned home because a decision was made quickly, under smoke, exhaustion, and fear. Others survived, changed forever, carrying the war not only in memory, but in the shape of their bodies. In the Civil War, survival did not mean returning unchanged. Medicine could preserve life while altering it forever. Behind every operation stood a chain of people, stretcher bearers, nurses, attendants, drivers, and exhausted doctors. Women became essential inside hospitals that never truly slept, bringing order, care, and endurance into the worst rooms of the war. They changed dressings, carried water, wrote letters, comforted the dying, and helped hold the hospital together. For the surgeon, these helpers were not background figures. They were the thin line between collapse and control. But even teamwork could not erase the impossible arithmetic of war. Too many wounds, too little time. After the largest battles, hospitals became cities of pain, improvised, overflowing, and desperate for relief. Gettysburg, Antietam, Shiloh, names remembered for battle, also became landscapes of medical crisis. The surgeon did not experience history from a map. He saw it through open doors, crowded floors, and trembling hands. Every room had a sound. Boots on wood, metal on the table, whispered orders, and fear held just below the surface. Every hour asked the same question. Could your mind survive what your hand were forced to do? Civil War medicine is often remembered as horror, but the truth is more complicated and more human. Many surgeons wanted to save lives. They were trapped inside a century that had not yet given them enough tools. They knew when a decision would haunt them, but the next patient rarely allowed time for grief. This was not only a test of skill, it was a test of endurance, judgment, and emotional survival. To survive as a battlefield surgeon, you needed more than courage. You needed to continue while breaking inside. And still, many continued, because inside a world built for destruction, their work was one of the few acts of resistance. The war created wounds medicine could barely understand, yet it also forced medicine to become faster, larger, and more organized. Evacuation improved. Records mattered more. Hospitals learned to manage numbers that once seemed unimaginable. But progress did not feel like progress to the man on the table or the surgeon standing above him. For them, history was immediate. It was breath, pulse, pressure, and the thin edge between decision and disaster. Imagine hearing your name called from three directions at once, knowing only one patient can be reached first. That was the true nightmare. Not the tools, not the sound of battle, but the moral weight of choosing. The longer the war continued, the more surgeons understood that survival was never just physical. Some carried those memories for decades. The field hospital followed them long after the tents came down. The war ended, but the questions it forced on medicine did not disappear. How do you treat mass suffering? How do you move the wounded? How do you decide when seconds matter? The answers shaped military medicine far beyond the 19th century. Yet this story is not only about systems. It is about whether one person could endure the center of them. Could you hold your nerve when the next life depended on your hands? Could you make a choice that might save someone, while knowing it might also break you? Could you keep seeing patients as people when the war tried to reduce them to numbers? That was the surgeon's hidden battlefield. Not the open field, but the space between mercy and necessity. By the final years of the war, field hospitals had become more organized, but never less haunting. Order helped. Experience helped. But nothing could remove the war from the surgeon's table. The nightmare was a world where healing had to happen inside the machinery of destruction. And that is what makes the question so difficult. Survival was not only about lasting through the day. It was about whether you could leave that hospital with your mind, your faith, and your humanity intact. A battlefield surgeon stood at the edge of what medicine could do and what human beings could endure. He could not stop the war. He could not silence the guns. But for a few minutes at a table, he could fight death directly. So, could you survive a Civil War battlefield surgeon's nightmare? Not as the patient, but as the one everyone prayed could save them. Because in that tent, survival was never simple. It was measured in seconds, scars, silence, and the courage to continue. But before the field grew quiet, the surgeon still had one more battle to face, the morning after. The operating tables were cleared. The lanterns were fading. But the choices made there would not disappear. For every life saved, There was another name the surgeon might remember in silence. This was the part history rarely shows, the cost paid by the people who tried to keep others alive. A surgeon could leave the tent standing upright, yet carry a battlefield no one else could see. And yet, the next battle could begin before he had time to understand the last one. That cycle, battle, evacuation, surgery, recovery, grief, became the rhythm of medical survival. The surgeon survived by becoming part doctor, part soldier, part witness to the limits of his century. He worked before antibiotics changed infection, before modern trauma care, before blood banks, before sterile surgery became standard. What he had was knowledge, speed, discipline, and a fragile hope that one decision could still matter. That is why the nightmare is not just what happened on the table. It is what the table demanded from him. It demanded speed without panic, compassion without collapse, and judgment without certainty. And in that pressure, Civil War medicine revealed something larger than war: the human will to save life inside destruction. The battlefield tried to turn men into casualties. The hospital tried, desperately, to turn them back into human beings. But the surgeon knew the truth. Even when the patient lived, the war always took something. So the question becomes darker. Could you survive success as much as failure? Could you keep returning to the same table, knowing the next decision might follow you for the rest of your life? Could you stand between a dying century and the future of medicine, with nothing but your hands and your nerve? A Civil War battlefield surgeon did not survive by avoiding horror. He survived by walking back into it again and again. So, could you survive a Civil War battlefield surgeon's nightmare? Not as the wounded man, but as the one everyone hoped could save him?